Global Health System Solutions (GHSS), in line with its vision to strengthen health systems, services and networks in developing countries, is improving access to sexual and reproductive health services in the northwest and southwest regions of Cameroon that have been experiencing deteriorating humanitarian situation for over 6 years due to an armed conflict. The organization has since July 2022 collaborated with the Cameroon Ministry of Health and the Ministry of Youth Affairs and Civic Education to provide sexual and reproductive health services to adolescents and young people in Buea, Limbe, Tiko, Bangem, Tombel, Tubah, Bamenda and Bamenda 3 health districts of the conflict-affected regions. Global Health System Solutions, in a bid to enhance the impact of sexual and reproductive health services in the targeted regions, built the capacity of over 200 community health workers, 100 field health assistants, 20 sexual and reproductive health advocates, and 10 supervisors. These field personnel were equipped with data collection and communication tools and deployed to all the 8 targeted health districts in the northwest and southwest regions to identify, manage, and refer cases that needed sexual and reproductive health services to the youth centers and health facilities. Through home visits, community surveys and outreach sessions within the health districts, the community health workers educated 417,338 adolescents and young people on sexual and reproductive health.
They educated me about menstrual hygiene. At least I didn't know that now.
From the lecture I got from the community health worker in the community, and even when I was referred, I came here, the field assistant still gave me another lecture, and I received my lecture. I believe this is going to help me a lot to prevent unwanted pregnancy and to save me from a lot of stress.
At first, I was ignorant of these things, but now I think I've been educated a lot, and I can boast that I can educate my friends who also are ignorant of these benefits, which are available free of charge.
They don't lecture we how to vaccinate people, how to take your picking vaccination.
The community health workers reached out to over 87,730 young people with sexual and reproductive health services, with many testifying of the benefits of the project.
I did not really know how to count my menstrual cycle. So even when I count it, at times I make mistakes. I will discover at the end that I'm pregnant. Like now I had four children, and my husband is not doing well with his job since the start of this crisis. I myself, the small little business that I'm managing is not really doing well. So since I took the family planning method, at least it has helped me for a very long while now.
I accepted to do the 5 years old so that it will prevent me from getting pregnant until the time I want to be pregnant again.
A single mother of one. I've heard about this family planning and I'm happy for it. The reason I took it is because I want to concentrate on my future before having more children.
The program let me for say I don't carry baby early because I'm still student. I still go to school and no one born now so it will destroy my future.
Barely 1 year into the implementation of the project, community leaders attest of drastic decrease in cases of abandoned babies, unwanted pregnancies, and other ills in their communities.
We have realized that sexually transmitted diseases / sexually transmitted infections has decreased, and also unwanted pregnancies has decreased. As well, family planning is on the rise, and so it's really improving maternal health.
And now you don't know yet that a child was delivered and thrown or abandoned somewhere. If you go to even the orphanages, you will not hear a report that a child was abandoned here and brought to the orphanage for these 9 months that the project has been in Tiko solution.
With the growing demand for sexual and reproductive health services in the 2 conflict-affected regions of Cameroon, Global Health System Solutions and partners have created, renovated and equipped 10 multipurpose youth empowerment centers to facilitate community engagement and coordination of sexual and reproductive health intervention.
A lot has been done in terms of renovation. It started by renovating the ceiling, renovating the windows, refurbish the toilets, and they have equally given us lots of material. We received 23 armless plastic chairs from them. We received a television set. We received a fan and other materials which are not only helpful to the center but equally helpful to the other government services that are based in this building.
We've had renovations in terms of painting, in terms of chairs, tables, and this will not only help us working in the center. We have other youth projects and programs that usually take place here.
Thanks to these centers, youth who were hitherto shy to visit conventional health facilities for sexual and reproductive health services now feel free to come there as their privacy is guaranteed.
You know, there are some girls that are afraid to even come to the hospital for family planning, but with the program, the community health workers succeeded to have them. And even those that were already registered at the level of the health facility, when we call for their rendezvous, they will always tell us that the community health workers has already passed.
Some of the youth in our community are open to come to visit some of those referral centers that Global Health has put in place. They no longer shy with those STIs that they used to have, owing to the fact that we have the centers that are there to receive them.
Besides these, Global Health System Solutions has donated 2 ambulances to the Cameroon Ministry of Public Health to strengthen the community referral systems and improve access to sexual and reproductive health facilities in the northwest and southwest regions of Cameroon.
Recently, we received an ambulance from Global Health System Solutions. They donated to us a beautiful ambulance. We're so glad because it came at a time when we were really desperate.
With the growing awareness and impact of sexual and reproductive health services in the 8 targeted health districts, the cry of many is that Global Health System Solutions and partners should continue and extend the sexual and reproductive health project in their communities.
We have done our best, the community workers, to get the population on board on what reproductive health care is all about, and now they have accepted the project and then they are willing to go to forge ahead, and it's coming at a time when the project is about to end, and so a little bit frowning.
It is now that the population are getting the importance of this program. If you can bear with me, at the beginning people were like, what are they talking about? But now they are already aware and they are prepared. So we are pleading that maybe the partners, the funders, should help us and give us some few months again.
In as much as the crisis continue, there is need for us to continue with the activity, because on a daily basis we find youths coming from different affected areas to Buea. As we attend to those who come, they keep on coming.
Though so much has been achieved, access to primary healthcare services and medical supplies in the northwest and southwest regions, especially in high-risk zones, remain a challenge as the armed conflict continues unabated.